Hey guys, it's Dr. Jackson over at the Sports Pod. I want to bring you another video today. Would like to continue on with my basically basketball related injury series. Today I want to talk a little bit about one of the most common types of injuries that occurs on the basketball court, and that is a sprain strain, in particular the ankle sprain. So most of you guys out there, or girls if you're watching, have at some point in time probably sprained your ankle. And you may have been out for anywhere from a couple of days to a few weeks, or maybe if it's serious enough, maybe even a few months. And some of you out there maybe have been put in boots. Sometimes you just wrap it up with some tape, put on an ankle brace, whatever. Today I'm going to talk a little bit about ankle braces, but then also an inversion sprain. What is it? How does it happen? And how to prevent it? So let's kind of go from here. So an inversion sprain is usually when your foot rolls in. So a lot of times when people sprain their ankle, they'll say, I rolled my ankle. And that's pretty much because your body's going one way, your foot plants, and you literally roll right over it. So what structures are involved in this? Well, there's usually three structures involved. And the most common structure involved is what we call your anterior talofibular ligament. What the heck does that mean? Well, I'll break it down for you. Anterior means it's on the front part of your ankle. Talo stands for your talus, which is a bone in your ankle. And fibular means fibula, which is the small bone in your leg. So you have your tibia, which is your shin bone. There's another bone to the side of that on the outside of your leg called your fibula. So that ligament pretty much attaches all of those structures together and prevents like forward movement of the ankle. Now, there's also another structure called the posterior talofibular ligament. That's the strongest of the three that I just spoke about, and usually is not necessarily involved, but it can be. And then you've also got your calcaneofibular ligament, which attaches the fibula to your calcaneus or your heel bone. So, in particular, like I said, most commonly affected is the ATFL, and it's rolled over. So, what does it look like? How do you know if you sprain this? Well, oftentimes you're going to get some swelling, you're going to get some bruising right along that kind of outer part of your ankle. It's probably going to be very tender to the touch. Generally speaking, based on the mechanism of injury, which is, how you injured it, I'll say, hey, look, you definitely got an inversion sprain. You're very tender to touch in these areas. You've got swelling. You may or may not be able to bear weight. You may or may not be able to actually walk. And depending on if you can actually do those things is going to tell me how severe the injury is. Now, you can always go, and get an x-ray, but the x-ray is really only going to be good at telling you if there's any sort of fracture or break in the bones. So that's what an x-ray does. It shows basically just bony structures. So you don't see the ligaments, the tendons, and the muscles involved, but an MRI would show that. Having said that, very rarely am I going to say, I think you got an inversion sprain of your ankle, go get an MRI. So traditionally speaking, they respond very, very, very well to basic strength and exercises, mobility exercises, and it's just a matter of kind of getting all that gunk out of there so that your ankle can move around, and then you can start the rehab process, and then you can get back onto the court a lot faster. So having said that, what would I do? Like, what are some quick tips on how to basically get on the court a lot faster? Well, first of all, I'm going to say don't use ice. That goes against, a lot of what you guys probably would do. But the ice actually constricts the blood vessels and it slows down the flow of everything, which you might think that's basically stopping inflammation, but it's not. It's just causing a backup in the system, and then as soon as the ice wears off, the blood, the swelling, everything just goes right back into that area. So what I like to do is basically compress it, just try to force all that gunk out of there, kind of massage the ankle, try to work that out of the area. That way you can start moving the ankle a lot faster, and that, generally speaking, is going to basically accelerate your recovery time. So go ahead and compress it, elevate it, get the gunk out of there, massage it. Just try to move it around as much as possible. That's going to activate all those little muscles in the ankle and keep it from stiffening up, but also help flush out everything through the lymph system. So that's essentially kind of, how I would attack it. Now you're probably thinking, well, I think he said something about ankle braces. So what about ankle braces? Well, I know a lot of you guys and girls out there probably wear ankle braces, which is fine. Generally speaking, I do not support ankle braces. The reason I don't is because it's a false sense of security there, and it's actually not allowing the structures of your ankle to support the ankle, which over time is going to weaken your ankle. So I know that you probably say, well, hey, look, Steph Curry, one of the best basketball players in history, he wears ankle braces every game. Well, that's great, but you're not Steph Curry. And also, he's had a lot of issues with his ankles. And so I think for him, it's more of just like a mental thing. But I guarantee you his ankles are strong enough at this point, and he probably doesn't have to wear them. It's more of just like, a security blanket type deal. But generally speaking, I don't like ankle braces, and I try to wean my patients off of them as fast as possible because I want the ankle to be able to support itself like your body was designed to do, and not have some outside kind of support on there. So having said that, that's my thoughts on ankle braces. That's essentially an inversion sprain in a nutshell. If you have any questions, feel free to contact me on social media. That should be down here in my left-hand corner. Once again, I'm Dr. Jackson from the Sports Pod, and move free.